Hi, I'm Sydney Rellinger. This is my head to toe. Here's my head to toe clear, clean, blank sheet. Okay, I'm setting it over here. Hi, I'm Sydney. I'm going to be your student nurse today. Can you tell me your name and birthday?
Caitlin Duffing, July 19th, 2001.
Alright, any allergies?
Nope.
Alright, good deal. So I'm going to give you a head to toe today. So it's just like a full body assessment kind of thing. But is that okay with you?
Mm-hmm.
Alright, I'm going to start out with some questions first.
Okay.
Alright, so what state are we in?
Michigan.
Alright, what year is it?
2022.
Okay, good deal. And do you have any previous diagnoses?
No.
Alright, any previous surgeries?
No.
Alrighty. What medications are you currently on?
Birth control.
Alright, and why are you taking that? Why did you start taking it?
For my acne.
Okay, and then does it change your periods at all?
No, they're really regular.
Okay.
Every month.
And then are you sexually active?
Yes.
Alright, and are you using some other form of contraceptive as well with your birth control to keep you safe from STDs and stuff like that?
Yeah, I use condoms.
Alright, and your periods are regular?
Mm-hmm.
And any side effects of your birth control or anything like that?
Nope.
Alright, and how long have you been on it?
About 3 years.
Alright, good deal. And then how often do you smoke?
I don't smoke.
Okay, how often do you drink?
I don't. I'm not old enough.
How often do you use street drugs?
Never.
Alright, can you tell me a little bit about your diet?
Yeah, I eat 3 times a day. Eat a lot of vegetables and protein.
That's good.
Yeah.
How much water would you say you drink in a day?
About half a gallon, maybe a gallon.
That's really good. Wow. Can you tell me a little bit about like what your physical activities like?
I work out every day.
Wow, that's really good. And then on a scale of 0 to 10, what's your pain like today?
None. I have no pain.
0?
Yeah, 0.
Okay, good deal. So I'm going to start out with getting some vitals for you.
Okay.
My blood pressure cuff kind of fell on the ground here. Alright, I'm going to start by rolling this sleeve up. Sorry, my hands are really cold. I like this tattoo you have here.
Oh, thanks.
It's really cute. Nice little smiley face and your freckles. How long have you had that?
A couple months.
Has it bothered you at all?
No, it's too tiny.
It's very cute. I quite enjoy it. Thank you. Alright, it's probably a little cold. Nice and tight around the arm here. Just gonna hang this here. Maybe. Alrighty. Make sure it's on my diaphragm here. Alright, your blood pressure was a good 118 over 74. Is that about normal for you?
Yeah, that's pretty normal.
I like it to be around or under 180 over 20, or 120 over 80, sorry. That is perfect. Alright, I'm going to get your temperature from you. Maybe. Alright, 97.5, that's good. Alright, I'm going to start now by getting your pulse and your respirations from you.
Okay.
I'm going to squat down. Knees are a little cracky. pulse was about 78, and your respirations were about 16, which are both really good. We like your respirations between 12 to 20. Okay, so those are good, and we want your pulse to be around 60 to 100, so those are both really good.
Awesome.
And then at this time, we normally do a SpO2 on you, but we don't have one here with us. So typically you want that to be around like 95, 97 to 100% on room air. And then I'm going to check for clubbing here, which I see none, which is good. And I'm going to check your capillary refill, and they are both under 3 seconds, which is what we want. So now I'm going to get started on your arms. So first I'm going to roll this sleeve up. Alrighty, I'm just gonna, feel them. Sorry, my hands are really cold. Your temperature is nice and warm. Your muscle tone is nice and even. I'm not seeing any abnormal moles or spots here. I do see you have a tattoo here. Have you had any issues with that?
No.
Alright, good deal. Alright, now I'm gonna feel for symmetry and like if they're bounding for your radial and brachial pulses.
Okay.
So I'm gonna do your radial. They're both nice and symmetrical and bounding. I'm gonna do your brachial. Also nice and symmetrical and bounding. So I'm gonna do some range of motion type of stuff with you now. So I'm gonna have you put your hands out like this for me. I'm gonna have you not let me push them apart. All right, don't let me push them in. Alrighty, go up, and then, yep, and then down. Beautiful. Can you do this for me? All right, and then this. Any pain with any of those? All right, I'm gonna make a swimming motion. I'm gonna stick my arms right here. All right, and then go back. All right, and that's checking for crepitus, and I don't feel any. So I'm gonna have you shrug your shoulders for me. All right, so that was testing for cranial nerve number 11, which is your spinal accessory nerve, and then I'm just gonna have you squeeze my fingers for me. All right, good deal. Nice and strong. Now we're gonna move on to your head. So you take your hair out for me. Thank you, ma'am. Beautiful dark hair. Oh, grab it. Thank you. All right. So let's start just by feeling around in your head here, making sure there's no unusual bumps or dents or anything like that. Have you had any dry skin or anything like that?
No.
Any dandruff?
Nope.
Any itching lately?
Nope.
All right, good. I'm not seeing anything. Your scalp is nice. I'm gonna feel your occipital lymph back here. Any pain?
No.
Alrighty. I'm gonna go ahead and do your pre and post auricular. I'm gonna start with your post, which is behind your ear. Any pain?
No.
All right, and your pre-auricular? Any
No.
pain? All right, good deal. So I'm gonna move on to your face. So I'm gonna have you make some faces at me. So this is testing cranial nerve number 7, which is your facial nerve. All right, so go ahead and raise your eyebrows. All right, and then smile, and then frown, and then puff your cheeks out like a chipmunk. Beautiful. Perfect. That's nice and intact. Now I'm gonna test cranial nerve number 5, which is your trigeminal, and I'm gonna have you bite down for me. Beautiful. Now I'm gonna take my pencil here, and I'm gonna touch different spots on your face with the eraser of it.
Okay.
And I'm just gonna have you close your eyes and tell me where I'm touching. All right?
Okay. My forehead, my right cheek, my left cheek, my chin.
Beautiful. That's nice and intact as well. So I'm gonna move on to your eyes. Do you have any glasses or contacts or anything like that?
No.
All right. So you see pretty well. All right. I'm sorry, my hands are cold. I'm gonna touch your eyeballs a little more, eyelids. Sorry. All right. Look down. Look up. All right, so your eyes are nice and clear. Your sclera is nice and white. Your conjunctiva are nice and pink, not irritated, not red, anything like that. So that's really good. So I'm gonna take my little handy dandy pen light here, and I'm just gonna check for your pupillary reflexes, your responses, and I'm gonna do that with directed consensual. So I'm just gonna shine a light in your pupils a couple times and see how they dilate and react to another. And I'm also going to check for combination while I'm at it. So,
Okay.
All right, just keep looking at me. direct and consensual pupillary responses. Now I'm just going to see your corneal light reflex. So I'm just going to see how my light reflects off of your corneas. All right, keep looking at me. All right, that's nice. I can see the good reflection. So I'm at it. I'm just going to have you stare at my pen light for me. And then look at the wall behind me. And then pen light. And wall behind me. All right, that's testing for accommodation. So I see that your eyes have perla, which is your pupils are equal, and they are round, and they react to light, and they also accommodate.
Okay.
So that's really good.
Sweet.
So now I'm going to be testing 3 different cranial nerves. So I'm going to be testing cranial nerve 3, 4, and 6, which are oculomotor, trochlear, and abducens,
Okay.
with your 6 cardinal fields of gaze. So I'm just going to look at my pen and just follow it with your eyes, all right? Not your head. Fantastic. So now I'm going to have you do some cerebellar function kind of things. So I'm going to have you touch your nose with your finger, and then touch my pen, and then nose, and pen, nose, pen. Beautiful. All right. So now I'm going to have you make an okay sign for me. All right, and then just flip your fingers through it. Beautiful. All right, now I'm going to have you put your hands like this, and then flip them as fast as you can. Great. Your cerebellar function is amazing. And I'm going to look in your nose. All right, we're just going to make sure it's nothing going on in there. And look back for me. All right, it's nice and pink and moist in there. There's no polyps, no deviated septum or anything like that. So I'm going to go ahead and feel your maxillary sinus right now. Any pain?
No.
All right, and your frontal sinus?
Nope.
No pain? All right. So do you have any problems with smell?
No.
All right, so I'm going to test your cranial nerve number 1. It's the olfactory nerve, so it's just your smell. So I'm going to close your eyes for me. And then take a sniff. What you smell?
Cinnamon.
Beautiful. Alrighty. So I'm going to move on to your mouth. So do you have any false teeth?
No.
Do you have any permanent retainers?
Yes, I have one on the top.
Okay, does that bug you at all?
No.
Alright, no bleeding gums, nothing like that. Alright, and do you still have your own tonsils? I don't know why you would have anybody else's tonsils, but do you still have your tonsils?
Yes, I have.
Alright, how often do you go to the dentist?
Like twice a year.
Alrighty. I'm just going to have you open your mouth for me. Alright, take a look at your hard and soft palate. Stick your tongue out. Alright, those look good. Alright, so now I'm going to have you stick your tongue out for me and then move side to side. Alright, that tests cranial nerve 12, which is your hypoglossal. Then I'm going to grab my tongue depressor here. Then I'm going to have you stick your tongue out. And I'm going to stick this out. Do you have a sensitive gag reflex?
No.
Alright, I'm going to stick this in your mouth and then have you say ah.
Okay.
Alright.
Ah.
Alright, your uvula goes up and down with that. That's fantastic. That is testing your cranial nerve number 9, your glossopharyngeal. And then I'm going to have you swallow for me. Alright, that tests cranial nerve number 10, which is your vagus.
Okay.
Now we're going to move on to your ear. So I'm just going to palpate your pinna a little bit. I see you got some nice piercings here. These bother you at all?
No.
Alright, I'm going to lift up on your pinna here. Look in. Look behind your ear. No redness, no swelling, nothing to be concerned about in that ear. How about these piercings over here? They bother you?
No.
Alright, I'm just going to palpate. I'm going to lift it up and look in and behind. Great, those look good. Alright, now I'm going to move on to your neck, and I'm just going to feel the rest of your limbs, okay? So I'm going to start here with your submandibular. Any pain?
No.
Alright, submental, sorry.
Mm.
No? Okay, and then I'm going to do your cervical chain. Pain?
No.
Alright, and I'm going to have you shrug your shoulders up for me. Alright, this is your supraclavicular. Any pain?
No.
Alright, while I'm here, I'm going to do some tissue turgor, which just test how hydrated you are. Went right back down, no tenting, perfectly hydrated, which I would expect with you having a half a gallon to a gallon of water a day. Alright, and then I'm just going to have you turn your head kind of like this for me. This way, sorry. Alright, I'm just going to feel your carotid artery just one at a time here. Alright, Alright, let's go good. And now I'm going to auscultate them, and then when I do it, I'm going to have you hold your breath, but I'll let you know when so you don't have to hold it the whole time. And I'm going to do that with my bell.
Okay.
Make sure that's on for me. Alright, go ahead and hold your breath. Alright, you can go ahead and let it go. That sounded nice and clear, no brewing, nothing like that. And again, hold your breath. All right, go ahead and let it go. No brewing or anything like that. It was just like a whistling kind of sound.
Okay.
Something we just don't like, a whooshing.
Mm-hmm.
We don't want to hear that in your arteries. All right, so now I'm gonna have you scoot back a little bit.
Okay.
I'm gonna go ahead and come around to your back. And let me hear real quick. I'm just gonna check your thyroid right here. Palpate it. Any pain?
No.
All right, good deal. So I'm gonna check out your skin back here. So you got a mole right here.
Mm-hmm.
Have you had that checked out?
Yeah, I have.
All right, nothing to be concerned about, I don't think.
No.
All right, good deal. So your skin looks nice. I'm just gonna see your spine. Sorry, that's nice and straight. All right, so now I'm just going to, percuss your lungs. I'm gonna do it 12 total times, 6 on each side.
Okay.
So, all right, I'm gonna start right up here. Oh, sorry, first, I'm gonna do your 2-to-1 ratio and your lung expansion.
Oh, okay.
So I'm gonna put my hands right here, sorry, they're really cold. I'm gonna have you breathe in for me. Beautiful, nice expansion. All right, I'm gonna feel right here. And then I'm gonna feel right here and right in between your breastbone here. All right, you have a nice 2-to-1 ratio. So we don't have to worry about barrel chestedness or anything like that, which is something that we worry about with people with COPD. Okay. And yeah, so now I'm gonna go into percussing your lungs. Again, it's gonna be 12 times in total. So. Go right under your bra here. All right, I'm hearing resonance with that, so that's what we want to hear. I'm gonna go ahead and listen to them, so I'll have you take some deep breaths for me.
Okay.
And again, it's just gonna be 12 times. I'm gonna listen to this with my diaphragm. All right, go ahead and take a deep breath in and out. Again. 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 And again. And again. All right, I'm gonna go right under your bra here. And again. And on the other side, under the bra again. Again. All right, 2 more times. And last one. All right, are you feeling dizzy at all after that?
No.
All right, good deal. Those sounded nice and clear. Nice, good breaths.
Awesome.
All right, now I'm gonna have you lay down for me. Come around here. I'm gonna take this pillow out from under you real quick, just so I can check for JVD, which is just jugular vein distension. So it's your vein right here, making sure it's not popping out or anything. All right, have you turn your head this way for me. Nothing there, other way. All right, beautiful. All right, we can go ahead and put this pillow back under. Yeah.
That's okay.
Okay. All right. So I'm gonna go ahead and listen to your heart now.
Okay.
So would you mind if I brought this down?
No, go ahead.
Is that comfortable for you?
Yeah.
Alrighty, just right there. So I'm gonna start here with your aortic, which is 2 intercostal space down on the right. So 1, 2, and I'm gonna listen with my diaphragm, and then I'm gonna switch it over to my bell to make sure there's no murmurs. All right, and switch it to my bell. All right, that sounds good. A nice lub dub. Now I'm gonna go over here to the 2nd intercostal space on the left, which is your pulmonic. 1, 2. All right, I'm gonna switch it over to my bell. All right, and I'm gonna go down to the 3rd intercostal space, which is your herbs. So this was 2. 1 down is about right there. Oh, sorry, diaphragm first. That's a beautiful heartbeat, nice lub dub. No murmurs there. And I'm going to go down to the 4th intercostal space, which is your tricuspid, which is going to be about mid-clavicular right there. Start with my diaphragm here. All right, and over to my bell. All right, and then last one, we're gonna go over to your 5th intercostal space down. It's gonna be right there. All right, thank you. And I'm gonna listen to this for a minute with my diaphragm, and then I'll listen to it with my bell real quick. This is just for your apical heart rate. All right, that sounded good. I got about a 78 for your apical heart rate. I just gotta listen to it with my bell real quick, just to make sure there's no murmur right there. Flip that over. All right, no murmur there, beautiful. All right, we can go ahead and pull this up for you. Now I'm gonna start with my abdominal assessment. Can I pull this up?
Go ahead.
All righty. This step right there is perfect. All right, so I'm gonna start by getting level with your stomach, thank you, and inspecting just to make sure there's no any unusual lesions, lumps, anything like that, anything. We don't want to see if you got your belly button pierced that have any issues for you.
No.
Oh, excuse me again. How long have you had it?
About a year and a half.
Yeah, I've had mine for like a year. I love it.
It's just so cute.
It is. It makes you feel so much better. All right, so I'm gonna start by listening to your bowels, and I'm gonna start in the right lower quadrant. When was the last time you ate?
A couple hours ago.
Alrighty. So I'm gonna go ahead and give her a nice listen here with my diaphragm. We're gonna start down here. All right, got about 5 gurgles there. Let's go up to the upper right quadrant. All right, 5 gurgles there. Go over to the left upper quadrant. All right, 5 gurgles. Go down to the left lower quadrant. All right, I'm hearing some hyperactive bowel sounds. Oh, excuse me, thank you. All All right, so that's good. That makes sense since you just ate a couple hours ago that your bowels will be hyperactive. So now I'm gonna go ahead and use my bell here that I just switched to and listen to, do a little bit more of a cardiac assessment down here. So I'm gonna start with your aortic. All right, go into your renal. And your other renal. And your iliac. All right, I'm gonna have you hike your shorts up a little bit for me so I can get to your femoral. It's gonna be right here. All right, and the other one. All right, that all sounds good. All right, so now I'm gonna percuss your abdomen. I'm gonna do about 3 different taps in each quadrant. So we're hoping we hear timpani here.
Okay.
So I guess we'll find out. Sorry. All right, I'm hearing timpani there. So I'm gonna go ahead and go up into your liver.
Okay.
Make sure that's dull because it's an organ instead of timpani where it's gonna be down here. All right, that's a little more dull up here, so that's where your liver is. All right, so now I'm going to do some palpation on your abdomen. So you just let me know if you have any pain at any time.
Okay.
And I'm gonna start with light palpation.
Okay.
No pain?
Mm-mm.
All right. Still nothing?
Nothing.
Any pain?
Nope.
All right, good deal. So now I'm gonna go ahead and go into my deep palpation.
Okay.
Same thing, just let me know if you have any pain. No pain anywhere?
Nope.
All right, that all feels good. So we're all done with your abdomen. So I'm gonna put this back down for you. Now we're gonna go ahead and move over into the legs. So I'm gonna start with inspecting them for edema, any lesions, things like that. Is this a birthmark?
Yeah.
Haven't changed shape or grown or anything?
No.
All right, good deal. I'm not seeing any dimpling, so there's no edema or anything like that. It looks pretty good. You're nice and warm. All right, I'm gonna have you take your socks off of you. All right, so we're gonna go ahead and palpate some pulses. I already listened to your femoral, but I'm gonna palpate them now, so I'm just gonna hike up your shorts a little bit. All right, I'm just gonna go right in here. All right, those feel nice and symmetrical. Now I'm gonna go into your popliteal. Have you bend your knees a little bit for me? Those are nice and symmetrical. Now I'm gonna go into your posterior tibialis. Those are nice and symmetrical. Now I'm gonna go ahead and do your dorsalis pedis. All right, that's nice and symmetrical as well. While I'm down here, I'm gonna go ahead and do your cap refill. Those are nice and under 3 seconds, which is what we want. And while I'm over here with your feet, I'm gonna do some range of motion. So I'm gonna do push down my hands like a gas pedal. All right, push them up. All right, push them out in. All right, push them out. All right, beautiful. I'm gonna grab my fork here, and we're gonna do some sensory perception.
Okay.
So this is going to be sharp, and this is gonna be dull.
Okay.
All right, so just close your eyes for me and let me know where I'm poking and if it's sharp or dull.
Okay. Right shin sharp. Left quad dull. Right quad dull. Left shin sharp. Top of my left foot dull. Top of my right foot dull. Bottom of my left foot dull. Bottom of my right foot dull.
Perfect. All right. So now I'm gonna go ahead and have you swing your legs over here for me as you sit up. All right, you feeling dizzy at all?
Nope.
All right. So I'm gonna have you uncross your legs for me and scooch up just a little bit more. But all right, so I'm gonna check your patellar reflex.
Okay.
All right, those look nice. All right, and then while I'm gonna have you swing your legs out for me. All right, this is just checking for crepitus. I don't feel any, so that's super good.
Okay.
All right, I'm gonna hand you your socks and shoes. I'm gonna have you put those on so we can do 2 more tests. And we're almost done.
Okay.
So first I'm gonna do your Romberg test. So that's gonna test cranial nerve number 8, which is your acoustic, which is just for your balance.
Okay.
Put your shoes on. You need help or you got it?
I got it.
Alrighty. And then after that, we're just gonna test your gait.
Okay.
This is just your walking and stuff like that. So we're gonna start out with the Romberg. We're gonna have you stand up for me. Feeling dizzy at all?
Mm-mm.
All right, we're gonna have you close your eyes and put your arms out at your sides. Just hold it here for a couple seconds. All right, that's good. All right, you got a negative Romberg, which is good. Again, that tests cranial nerve number 8, which is your acoustic.
Okay.
And so since you have a negative Romberg, we can go ahead and test gait.
Okay.
So we're gonna have you walk with me, just straight up a couple feet. All right, and then we're gonna turn around and walk heel to toe for me. Beautiful, go ahead and sit back down, that's great. So based on today's assessment and your history and a bunch of questions that I asked you, I'm not seeing any moisture, shear, friction, anything like that. Your nutrition's really good, your activity's really good. So I'm gonna go ahead and give you a 23 out of 23 on your Braden scale.
Perfect.
I'm just gonna check my sheet real quick, make sure I didn't miss anything. Alrighty, I think that's it.
Okay.